Hi, my name is Carolyn Lenn, and I'm one of the health advisors here at Washtenaw Community College. Today I'm going to share with you some information about our nursing program. It is a pretty comprehensive presentation, so hopefully you'll be able to get all the information that you need when it comes to planning your nursing pathway. All right, and we do have a pretty comprehensive PowerPoint to go along with this. One of the first things we like students to know about our nursing program is that it is a second-tier admission. First, what that means is everyone needs to apply to Washtenaw Community College as a whole, and then another specific application is required for a nursing program once specific prerequisite courses have been met. That application would then be completed and submitted to our health admissions office. Another thing we like students to know right off the bat is that WCC has a competitive admissions process. Whereas other colleges and universities might utilize a waitlist system, we have a competitive admissions that's very much based on grades of the prereqs. And I do apologize in advance, I'm going to be very repetitive, but I just want to make sure that it's a sticking point. It's also important to know that once students are selected for our nursing program, they will be required to undergo drug screening as well as a criminal background check. If it has been found on their background that they have a felony within the last 15 years, that would prevent them from being able to participate in our nursing program. And likewise, if a student has a misdemeanor within the last 10 years that involves abuse, neglect, assault, battery on another individual, this would also be a barrier in being able to participate in our nursing program. We would just rather have students know that information in advance and hopefully avoid any types of situations. As I mentioned, there are prerequisite courses that need to be taken in advance prior to applying to our nursing program. Now, the majority of these academic courses require a minimal grade of a C. However, we strongly encourage much higher than the minimal grade in order to be competitive. But just to go through those academic prereqs, you can see them on the slide in front of you. Now, the first one is going to be an English composition course. At WCC, our English Composition 1 is English 111, and that's a 4-credit-hour course. Students could also use English Composition 2. At WCC, that's English 226, and that's a 3-credit-hour course. The second academic prereq is going to be a communications course, and again, there are some options. COM 101 is our Fundamentals of Speaking course, COM 102 is our Interpersonal Communication course, or COM 200 is our Family Communication course. All of these communication courses are 3 credits, and again, a student just needs to choose one communication course to meet that communication prereq. The third academic prereq is going to be a math course. The majority of our applicants use Math 160, and that's our basic statistics course. However, if a student has a Math Level 4 course or higher, this could also be used in lieu of statistics. Some examples might be Math 176, which is college algebra, or even a trigonometry, pre-calculus, or calculus classes could all be used in lieu of statistics. But as I mentioned, the majority of our students would probably take the Math 160, our 4-credit-hour stats course. Now, the fourth and final academic prereq is Bio 111, and that is our Anatomy and Physiology course at WCC. Now, for this prereq, the minimal grade of a B- is required. However, again, getting a much stronger grade is going to make an applicant much more competitive. The other detail that's important to note with regard to the Anatomy and Physiology course at WCC is that before students can enroll in Bio 111, they have to have prereqs of both biology as well as chemistry completed beforehand. Now, this could be at the high school level, as long as the grade was a C or higher and included a lab, or it could be at the college level, again, included a lab with a grade of C or higher. Some of our students, it might be a combination. Maybe they took biology in high school, and maybe they needed to take chemistry in college, but just be aware that that needs to be sent over to WCC on a transcript, again with a grade of C or higher, in order for our system to allow a student to take our Bio 111. And on that note, with regard to transcripts, we strongly encourage students to send official transcripts early on in their journey. The reason is it goes through a credit evaluation process, which can take a little bit of time, and sometimes we do have students who may think that they have one of the prereqs completed, but in the end it doesn't transfer in directly, and it might postpone when they can apply to their nursing program. So again, send those transcripts in early. In addition to the academic prereqs, our nursing admissions also requires a form of CNA certification. Now, that can be a current or expired Michigan CNA license, and for students who want to get their CNA, the course at WCC to take would be HSC 100. That's our 4-credit Nurse Assistant Skills course. The way it unfolds is once students successfully complete the course, they would be eligible to take the state certification exam, and once they pass the state certification exam, they would be eligible to get their Michigan CNA. Many students want to work at a long-term care facility or state facility, and these venues frequently do require a CNA. So again, HSC 100 is the course that would lead to a CNA. Now, we do accept a variety of alternatives to a CNA. And this is partially due to the fact that there's been a reduction of our CNA course of HSC 100 offered at WCC. So as you can see at the bottom of the slide, these courses all will meet that requirement of meeting the CNA. So successful completion of HSC 100, HSC 164, or HSC 165, as long as the grade has been a C or higher, all of those will be accepted as meeting that CNA requirement portion of the admissions. Like I said, some students are interested in getting the CNA, and again, HSC 100 is the course that leads to that. Generally, we do offer both daytime and evening sections of the class. It can also be offered in a blended format, which means your lecture might be online, but because it does have that clinical and lab component of the course, those would be in person. A reading and writing level 3 is required for HSC 100, as well as 100% course attendance is required. And then the way the CNA fits in is once students successfully complete HSC 100, they're eligible to take the state certification exam, and then once they pass that, they would be able to get their CNA for the state of Michigan. Other students aren't interested in getting their CNA, so taking our HSC 165 Foundations of Caregiving course is an option to meet that requirement. This is a 4-credit-hour course, just like HSC 100, and like I said, it can be used for that application requirement. It's similar to the Nurse Assistant Training Program, but there are no face-to-face meeting times and there are no clinicals. This class is strictly designed to give students that foundational knowledge of providing care for others. And it's offered in a blended format. But just to be clear, HSC 165 does not lead to a CNA certification. Again, just to recap, if students have completed one of those on the slide, including HSC 100, HSC 164, or 165 with a minimal grade of a C, any of those can be used to meet that CNA piece, along with for those who do have their CNA, whether it's current or expired, will also be acceptable. Another requirement of attending the nursing or applying to the nursing program is attending a nursing information session or watching this video. We want to make sure that all of our applicants have all the information they need about the nursing program and how the admissions works. The last and final component of applying to the nursing program is successful completion of the ATI-TEAS entrance exam by meeting the required proficiency scores. If you're not familiar with the TEAS, it stands for the Test of Essential Academic Skills, and it's a standardized time test that measures 4 content areas, including math, reading, English, and science. And as you can see on the slide in front of you, these are the required proficiency scores. In math, a 60% is required, reading a 70%, English 60%, and a science 45% is required. I also want to be clear that all proficiency scores need to be met in order to be able to submit that nursing application. So just passing one section will not be sufficient. I do like to talk a little bit about the TEAS because it can be a source of anxiety for some of our test takers. So there is a bunch of material out there that can help students prepare for the TEAS. And I am going to cover some of that. And I do have a website here, a couple things that I wanted to share with you today. With regard to the TEAS, students are allowed 3 attempts within 5 years. So if a student took it the first time and didn't pass all sections, they would have 2 more tries to try to pass all sections within that 5-year window. Also, likewise, we hold the highest score in the system. So if a student took it the first time and passed 2 sections but didn't pass 2 sections, on their second attempt, they really only have to focus on the 2 sections that they did not take previously. Having said that though, I strongly encourage students to prepare for the TEAS, and we do have some information to do that. The website in front of you, and again, to get to this website, I usually recommend students remember the phrase health and second tier admissions, because that can help you go back and forth between the TEAS page and the application page and whatnot. So on the left-hand side here, I'm going to click on TEAS testing information. And if you do intend to take the TEAS through WCC, you need to be a WCC student first. If you get to the TEAS testing information page, on this very top page, or top part of the page, it'll show you the 4 required proficiency scores that I went through, as well as some of the information that I just covered as well. And then it will also tell you exactly how many questions you'll encounter for each of the sections. And then beneath that, you'll see schedule your TEAS test, and that's where you can schedule to take your TEAS if you take it through WCC. Now, WCC is going to ask that you create an ATI account, so just be prepared to do that. Underneath that, though, is some free tests or some different test material that you can access when preparing for the TEAS. First of all, our bookstore does sell the ATI TEAS study manual that you can purchase. And this is a book that will be filled with a bunch of questions that you can prep for. It'll have some information about content you'll want to be aware of. And then at the back of the book, there'll be a practice test that you can take. Now, before you spend any money, I strongly encourage students to connect to our Learning Commons website. And again, you can just click on that right off the TEAS testing page, and you'll get into touch with the Learning Commons. They have a bunch of great resources up there all the time that you can access when prepping for the TEAS. First of all, it'll have pretty comprehensive PowerPoint presentations for each of the 4 sections for the TEAS. So whenever you have the time, you can go through those presentations, get familiar with the content, get familiar with sample questions, and that is a great resource that you can always access. One of the other features that the Learning Commons has is they have live TEAS test prep tutors that you can meet with on campus. You'll want to make sure that you stay connected to their calendar so you are aware of what days those are on campus and what sections of the TEAS tests they are covering on those days. So just wanted to talk a little bit about the TEAS since obviously it's needed for the admissions. If you take it through WCC, you also do not need to send a copy of your scores, but if you take it elsewhere, you will need to. Now on to our competitive admissions process. Once students have met all of those requirements, and just to go through them really quickly again, that would be the 4 academic courses, that CNA piece, passing the TEAS, as well as viewing this video, they'd be able to apply to the nursing program. Then once applications have been submitted and the deadline has passed, the Health Admissions Office is going to use a point scale to rank all the applicants from highest to lowest. I always get asked the question, well, how do I get points when I apply to the nursing program? So that's the next thing I wanted to show you is the point scale system that the Health Admissions Office is going to use. Again, the best phrase to type in the search bar is Health Admissions, and the very top link will take you to our Health and Second Tier Admission page. And if you scroll down underneath all the check marks, the first thing I wanted to show you really quickly here is the nursing registered link. Now this is the actual link you'll want to go to when it comes to applying to our nursing program. But right beneath that, you'll see the point scales in the bold letters, and you'll click on 21-22 because that is the current school year. And that will bring up the PDF file of the point scale system that the Health Admissions Offices use. Now, the very first page, you'll notice that WCC's grading scale is there. And the reason that is there is because if a student took a prereq at another college or university and they utilized a different grading scale, just be aware that when they apply to our nursing program, the WCC grading scale is going to be applied. And then on the second page begins the 6 different factors that come into play when an applicant's points are tabulated. The very first factor, and the most significant, is what we call the cumulative program prerequisite GPA. So if you remember, those 4 prereqs we talked about, again, that's the English composition, the communications, the math, and the A&P, just those 4 classes are averaged to come up with the program prereq GPA. Not a cumulative, not a yoga class, just those 4 academic prereqs. And then what they're going to do is determine that and then apply the points that are associated with them. You'll also notice in the italicized print that they use a quality point when they make that calculation. If you don't feel like reading that, essentially what that means is this. The prereqs that have more credits affiliated with them are going to have a more significant pull in that prereq GPA. So for example, that 5-credit A&P class is going to be worth more than a 3-credit communication course. Okay, but again, it's just those 4 prereqs. Let's take a couple of simple examples. Let's say a student has a solid A or solid A's for all 4 of those prereqs. That would be a prereq GPA of a 4.0, and that pulls a candidate in 63 points. Now, if a student has solid B's for those 4 classes, That would be a prereq GPA of a 3.0. And looking at the scale, you can see that pulls a candidate in 33 points. So there's a very significant difference between having a B average versus having an A average. So when I advise students, I usually encourage them to bring their A game for those 4 prereqs because it's really going to make a significant difference in how competitive they are. Then the second factor is going to be residency, and this is going to be determined off of a driver's license or state ID at the time of submitting the application. If on this document it shows that a student lives in Washtenaw County, being in district, they would get 8 points. If they're out of district but still in Michigan, they'll get 3. If they're out of state or international, they won't get any points. But if you look at these points, you can notice they're very insignificant to what a strong prereq GPA is going to bring in. So again, when I advise students, I really like to hit home on the fact that those prereqs play a very significant role in the admissions. Now the third factor, if you look at the scale, is experience, but you can skip right over that because it's not applicable for nursing. All of our health programs that have an admissions use the same scale, so some of our other programs do take experience into account, but again, not nursing. The fourth factor is going to be military or veteran status. So if a student has a DD-214 form and submits that with the application, they would be awarded 5 points. And the fifth category is courses taken at WCC. So for any prereq taken at WCC, a student will be awarded 1 point per prereq. I just want to be clear, it's just the prereqs that come into play, not the support classes or any other course, just the prereqs. So a student at WCC could max out with 4 points in this category if all 4 prereqs were taken at WCC. And the last and final factor is alternate candidate status. If a student applied previously to the nursing program but wasn't outright admitted, but was given alternate candidate status and didn't end up getting in the program, on a forthcoming cycle they can apply 4 points. And in the extremely rare condition, if a student was an alternate for 2 separate cycles, they could apply 8 points in a forthcoming cycle. So as you can see, then what happens is the points will then be tabulated, added up, and then the applicants are ranked highest to lowest. And depending on the cycle, the top candidates will get in, depending on how much space we have to admit for that particular cycle. All right, so that is how the selection process works. Now, once the students are chosen for the nursing program itself is 4 semesters in length and takes place over the course of 2 years. So that would be either fall, winter, or winter, fall, depending on the cohort they were accepted to, okay? Now, in addition to the nursing classes, there's going to be a variety of courses that are also required by the nursing degree. Now, some of these, actually all of these support courses can be taken earlier. The nursing classes cannot be taken earlier until after a student's been accepted, but the support courses a student can take earlier. And we strongly recommend it because of the intensity of the nursing program itself. So just to go through the support course list, the first one is going to be a hospital microbiology. At WCC, Bio 147 is our 1-credit hospital microbiology course. However, if a student wants to get their BSN afterwards, that bachelor's degree, instead, we encourage them to take Bio 237, our 4-credit microbiology course. In addition to microbiology, pathophysiology is required. At WCC, Bio 212 is the 4-credit hour course for that. We also are going to require Psych 206, Lifespan Development and Psychology. However, if a student has taken Psych 100, they have the option of taking the 3-credit Growth and Development class instead, HSC 147. This is not a detail we expect students to memorize, but I would like to make a plug here that this is a great time to go make an appointment with your academic advisor when you're planning some of these classes, just to make sure you're planning the ones that fit best for what you're bringing to the table in terms of your coursework. Then in addition, we're going to require PHL 244, our 3-credit course, that's Ethics and Legal Issues in Healthcare. Now, for all of our students who have been accepted into the nursing program, they will be required to be CPR and first aid certified. If a student needs to attain that certification, they can take our HSC 131 course. I want to make clear here, though, that we do not encourage students to take the CPR class while they are working on their prereqs. The reason is the CPR certification has a 2-year window before it expires. So if you take it too early, what happens is it'll expire and then you'll have to retake the class. So if you want to maximize the 2-year window of this course, the best time of taking it is right before the actual nursing program begins. And last on the list here, you can see NUR 115. That is our 3-credit pharmacology course. Now, before students can take this class, they have to complete micro and patho first. The other thing we like students to be aware of is that if a student wants to take pharmacology early, a grade of a C+ is required to pass as per the rules of the nursing handbook. NUR 115 is technically a nursing class, although they do allow students to take it early, again, if they've completed micro and patho. Okay, so because the nursing program has so many pieces to this puzzle, we do like to throw out some advising tips that hopefully can help make this journey and planning a little bit easier. First of all, please keep in mind, before you can take any of the prereqs, you have to be at level 6 in reading and writing. You'll want to work with your academic advisor if you're not there, so you can sequence those classes in a way where you can get to level 6. And likewise, a student needs to be at Math Level 3 before they can enroll in Math 160, that statistics prereq. Also, just want to remind students that they need to complete bio and chemistry and have it on a transcript before they can enroll in A&P, the Bio 111 course. In terms of prioritizing, we strongly encourage students first to focus on those prereqs before the support courses. The reason is you can't apply to the program until the prereqs are done. You can weave in the support courses, but again, the prereqs should be the priority so that you'll be able to apply, hopefully in a timely manner. In terms of taking the T's, we do encourage students to have A&P or as much of that class under their belt before taking the T's. The reason is anatomy and physiology is going to be a very significant portion of the science part of the T's test. At the bottom of the slide are just the different URLs in terms of accessing the application, the point scale, and the T's test. But again, if you type in the phrase health admissions into the WCC search bar, it'll allow you to go back and forth when navigating between these various sites. And then just keep in mind that a criminal background check will be required upon acceptance to the nursing program. A couple of other tips. We always encourage students to really consider the sequencing of coursework. And we strongly encourage students to take a good look at their math and science background. Math and science are a key part of the prereq, so if you take everything else that doesn't involve math and science, you're going to hit a roadblock. So we strongly encourage students to look at that right from the beginning and address their math and science background. A&P Bio 111 is the class that can give students the most run for their money in terms of being challenging. So we strongly encourage students to allocate enough study time daily so they can be successful in this class. Instructors at WCC might encourage students to be able to set aside 3 to 4 hours a day of study time so they can get a strong grade in Bio 111. If a student comes to WCC and they don't have any previous background in science, we strongly encourage students to take biology before chemistry. The intro bio classes at WCC are Bio 101 and Bio 102. The intro chemistry class is Chem 101. However, before students can enroll in Chem 101, they need to be at a Math Level 3. So again, it falls back on the significance that math plays. If you don't have a math level, you'll want to work with your academic advisor on taking either the ALEKS test or sequencing classes. Once students have a pretty good handle on those prereq courses, then we encourage students to turn and focus on completing those support courses to lighten the load. We strongly encourage students to try to complete as many of those support courses prior to starting the nursing program to reduce course load. The nursing program is extremely intensive. At the very least, we strongly encourage students to complete at least micro and patho. If they don't, the first semester of the nursing program is going to include micro, patho, pharmacology, and an 8-credit nursing concept course. To be honest, I don't see students who can handle such an intense load. So again, try to complete micro and patho beforehand. And if I haven't said it enough, I'll say it one more time. Because the nursing program has a competitive admissions and because of the way it's structured, we encourage students to get that A grade on prereq courses. Now here's a couple of tips in terms of nursing classes. All NUR classes require a minimal grade of a C+ or 78%. A grade of a solid C is considered a failure for any NUR course. And likewise, a withdrawal or W is considered a failure. This needs to be taken into consideration if taking pharmacology prior to the start of the nursing program, because the grade and failure criteria still applies. If a student acquires 2 failing NUR courses, it results in dismissal from the program, and once students are dismissed from the nursing program or get those 2 failing grades, they are not allowed to reapply to the nursing program. Now this slide just goes through a couple of examples of how you could sequence your courses. The top example is someone maybe who needs to work on their science background and take a bio and intro chem class before they can take Bio 111. The bottom example shows a student who's already completed a bio and chem course in their past and maybe is already at level 3 in math. Many of our students are using Reconnect or Frontliner scholarships, and for many of those programs they need to be at 6 credits. So again, another plug to meet with your academic advisor so that you can successfully plan classes in a way that meets your financial aid eligibility as well as allow you to be successful. So the next thing I just wanted to cover here is the actual nursing application itself. Now, it may not be posted yet, but when it is, it'll look pretty similar to this old one that I have on the screen right here. I just like to go through some of the components of it since there are quite a few questions students have about how to fill it out and how to complete some of the various sections. One of the things I always want to point out though is once you do pull up the actual nursing application at the very, very top, it lists when the application is going to be due. So you want to make a note that you want to make sure that application is submitted by that day and time if you are planning to apply for that specific cycle. Now these applications are fillable PDFs. So what that means is you should be able to type your information, save it, and then you would email it in as an attachment to our health admissions office. Sometimes I recommend students start to fill it out, save it, get out of it, and then get back in it just to make sure everything did save, because nothing is worse than completing all 7 pages, thinking you've saved it, and then to pull it up and lo and behold, it's blank. So having said that, if you look at the very top part, you'll put in your WCC student ID number, that @00 number, and hopefully the rest of that section is pretty self-explanatory on how to fill out. Then underneath that is the required checklist. So for number 1, admission to WCC, essentially what that means is if you were able to write that @00 number, then you did previously apply to WCC and you can go ahead and check that off. Number 2 is the date that you either viewed this presentation or attended a mandatory nursing info session. So you'll want to make sure that you write that in there since a report is generated and sent to our health admissions office, and that way they can check the report and verify that you viewed it. Number 3 then begins the program prereq courses. So as you can see, the first one starts off with math. Now if you've taken your prereqs at WCC, I do think it's pretty self-explanatory to fill out. So for school, you'll just write WCC, subject MTH. Course, you'll put 160 if that's what you took, whatever your grade was, whatever the 4 credits, and then you would just leave the WCC equivalent blank. Now, if you took your course elsewhere, again, you'll need to send those official transcripts early on since our transcript evaluators do assign an equivalent for those courses, and that's what you would need to write here, along with all the information that pertains to that specific course that you took elsewhere. Now the second one's going to be a bio, anatomy, and physiology. So again, if you took it WCC, it's going to be a single line across for the 5 credit hour course. Again, if you took it elsewhere, most other colleges and universities have a sequence. So anatomy, physiology 1, anatomy, physiology 2. So for that situation, you might need to write 2 lines, one for the anatomy, physiology 1, the second line for anatomy, physiology 2. Just be aware that all grades need to be at that B- or higher to be able to be used for the nursing admissions. But the WCC equivalent hopefully and should be Bio 111 for each course. Now the third prereq is that communication course, and so you would put that in here. Sometimes I get asked the question, well, what if I took Com 101 and Com 102? Which one do I put down? And I always tell students you want to put the one that has the best grade, because after all, that's what you want the health admissions office to calculate. And that also goes into play if you took the same course twice. We just used the best grade for the admissions here at WCC, so you just want to list the one that has the best grade as well. And then the fourth and final prereq is English 111, so you would put that there. Then number 4 is the CNA piece. So again, there are a lot of exceptions that we're accepting for the nursing program, whether it's just completion of the course, an old expired CNA, or a current CNA. So whatever one is relevant to your specific situation, that's the one you would check off. And if you do have a CNA, again, whether current or expired, you would include that as an attachment with your application. Then number 5 pertains to the TEAS exam. So if you notice it, the way it's broken up, they have it by section. So you'll need to write in your passing score that you acquired for that section, as well as the test date that you earned that score. If you took it through WCC, then you would write your testing center of WCC. Even if you took the test remotely, if you signed up through WCC, then you would make sure that you would put WCC as your testing center. Then beneath that is going to be quite a few different pages that you'll need to make sure you read thoroughly and understand thoroughly so that you can sign thoroughly that you've understood what has been included. And then the optional checklist. So if you remember, we talked about the military or alternate status. That is the location where you'll include that information. And then, like I said, this application has quite a few pages of information that you're going to need to read thoroughly, understand thoroughly, and sign thoroughly. And you can indicate that because at the bottom of those statements, that's where you're going to need to print your name, sign it, include your student ID, as well as date it. Now, since these are fillable PDFs, you can go and print your name for a signature, and they will count it as a signature as long as you email it in from your WCC email. If you want to put a fancy font for your signature, by all means, you are free to do so. And then as you can see, underneath that is student notes, and most of our applicants leave that blank. But I did want to point out that beneath that is the email address that you'll want to make sure you send your completed application to, that health admissions there. That is how most students are submitting their application these days, and we are encouraging it. Just make sure you send it in from your WCC email address. But the application doesn't stop there because there, again, are quite a few pages, again, that you're going to need to read over thoroughly and make sure you understand. This essentially is a contract, and they want to make sure that all applicants are fully aware of what is entailed of the nursing program. They don't want there to be any surprises. They want to make sure students are fully aware of what they're getting into and some of the obligations that the program has. So I just want to make sure that students are aware of that and that they really thoroughly complete the application. All right, so back to our PowerPoint here. So we just covered that. As far as the admission cycles go, as I previously said, we have 2 different admission cycles. So for the fall start, we accept 72 students, and this will back up to a December application deadline. And then our second cycle will be a winter start, which will be in January. And for this cycle, we take closer to 44 students. And again, this one will back up to a May or June application deadline, okay? All right. In terms of submitting the application, we do have a couple of tips for that as well, just to make sure that everyone has met all the requirements and submitted everything properly. Because there are so many pieces to the application, we do have a few tips that we wanted to share with you in terms of things to consider before you submit. Number 1, make sure you read the entire application carefully. And again, if you have official transcripts from other institutions, you want to make sure you send those early on. Make sure that when you submit the application that you submit all pages of it. And when you submit the application, make sure you submit it using the WCC email address. I always encourage students too to check to make sure that they've signed and dated all the required places of the application because there are quite a few. When filling out the prereq section, it can be helpful to have the actual transcript of those institutions in front of you to make sure that you can accurately record the course number, the college name, as well as the amount of credits. And then make sure too you include the WCC equivalent. As for the T's, if you did not take it at WCC, you will need to have ATI send a transcript of your scores. If you did take it through WCC, you do not need to have them send a transcript of your scores since we will automatically receive them. A couple of other considerations before you submit the application is make sure with your application that you include all the required documentation, such as the CNA, as well as your driver's license and state ID. As for the CNA, if you have it, you can either use a scanner or a camera phone to take a picture of it. As for your driver's license or state ID, you do need to include a front side as well as a back side when you submit it with the application. And again, you can use a scanner or a camera phone to take clear pictures of that documentation. Likewise, with regard to residency, what you have on your driver's license or state ID should be consistent with what we have on file here at WCC. When you are getting ready to submit the application, you can submit it in the semester you are completing those final prereqs as long as everything else has already been done. So for example, if you're finishing up Bio 111 and you've already taken the T's and passed it and you've already met that CNA piece, you can go ahead and submit the nursing application before the Bio 111 class is done, as long as the course is going to be done by that application deadline, okay? And also just make sure you meet all those requirements. It's also important to know that every application cycle is separate. So if you applied previously to the nursing program and was not accepted, you do need to complete a new application and submit it to get considered for a future cycle. And last but not least, I just want to encourage you, if you do continue to have questions, to reach out to our health advising team. Again, my name is Carolyn Len, and Whitney Lee and Michael Brown also do advising for our health science programs. The nursing pathway has quite a few pieces to the puzzle to it. And although I hope this information is helpful for you, students may still have questions after that or still may require some additional planning. So again, please make those appointments with your academic advisor to help sequence those classes in a way where you can be successful and get you to applying to the nursing program. Thank you so much.